My name's Jessica Cox, and I'm the Director of Quality and Patient Safety for UT Health Tyler. Each day across the Ardent system, errors occur that have a direct impact on patients, families, and caregivers. In this module, I will focus on harm and errors and discuss how hospitals within our system approach safety each day and how we achieve zero harm to our patients and caregivers. HPI is a consulting firm that interviewed people across the U.S. and asked them what they wanted most from their healthcare experience. They compiled the results and found that most of them fell into these three categories. What patients said most often was, "Don't harm me." They felt the most important thing to them was that we don't cause them additional harm. I would have to agree. You don't want to go to the hospital with one condition and leave with several others. The second most common thing they said was, "Heal me." Makes sense. When you're sick, you go to the doctor so they can fix you or at least properly diagnose you. Last but not least, patients said they want caregivers to be nice to me. It seems like such a simple thing to ask, yet it makes a huge difference in the patient's perception of the care they receive. Take a restaurant, for instance. How many times have you gone somewhere and gotten exactly what you asked for, the way you asked for it to be prepared, paid an expected cost, the food was delicious, but your waitress or waiter took forever to get you what you wanted, never offered an explanation, and acted like you were an inconvenience to them? Do you want to go back? Probably not. Within a healthcare experience, you have so many highly skilled and professional caring people working to heal patients, and one person having a bad day can make that patient question the overall experience and whether or not they want to return. Did you know that about 1 in 10 patients experience an adverse event during a hospitalization? Roughly 1 in 2 surgeries have a medication error and/or an adverse drug event. More than 700,000 outpatients are treated in the emergency department every year for an adverse event caused by a medication. More than 12 million patients each year experience a diagnostic error in an outpatient care. About 1/3 of Medicare beneficiaries in a skilled nursing facility experience an adverse event. 1 in 10 patients develop a healthcare-acquired condition, such as an infection, pressure injury, fall, or an adverse drug event during hospitalization. Would you agree that these are staggering statistics? I think we can agree that medical mistakes occur far too often with significant impact on lives. It's important to remember that these statistics are more than just a number, but they are actual lives. All of these errors are preventable, but it requires a culture that values and commits to safety. We must listen to our patients, parents, and families. I'm a mom of twins. Overall, my pregnancy was great, but the last 2.5 months, I started having symptoms that just didn't seem right. When I discussed these with my doctor, she thankfully listened to me instead of writing me off like a crazy pregnant lady. Some of these symptoms I was experiencing were things I dealt with all the time, but were more intense or frequent. But they also weren't presenting at the normal time frame, which my doctor was a little confused. I ended up getting admitted to the hospital due to severe preeclampsia that ultimately became HELLP syndrome. Thankfully, I had a great team that helped deliver my babies safely while keeping an eye on my current situation. Had my doctor not listened to me, there's a chance my story could have been different. Delivering the right care for every patient every time requires a different way of thinking about error in medicine and a new approach to preventing harm. Stories like Josie's give us a call to action, which is our Mission Zero. You will soon learn about the Mission Zero safety commitments and error prevention techniques that help prevent errors from occurring. As the quote states, we must take a new approach to prevent harm to our patients and caregivers. Let's watch Don Berwick's story regarding the error and the impact it had on him and the baby.
There was a child, tiny little baby, who needed a transfusion for erythroblastosis fetalis, an incompatibility of blood between the mother and the baby. We long since have learned how to prevent that, so we no longer need to change the blood. But in those days, what you did is you literally washed out the baby's blood and put in new blood because the baby's blood was being attacked by the mother's antibodies. That was called an exchange transfusion. And you couldn't do it just once. You had to do it many times during the first few days of the baby's life. And that night, I was on call. I was the covering young doctor and called to the baby's bedside. And I was very tired. I set up the transfusion. The nurse handed me a bag of blood. I hung the blood, connected it, catheterized the baby's vein, and then started the transfusion. And then the baby started to die. He looked terrible. He was gray and he was writhing. The moment that the fellow walked in, I realized the reason was the bag that I'd hung up wasn't whole blood, which we were supposed to use. It was packed red blood cells. It was the wrong thing. And the reason it was wrong was that in that hospital, before they sent you blood from the blood bank, they centrifuged the blood. So there were two bags. There was a bag of cells and a bag of plasma fluid. And what you're supposed to do is mix the two back to whole blood before you give it. I didn't know that. I wasn't trained in that hospital. No one had told me. And I hadn't seen the other bag, and the nurse didn't tell me about it. So the baby was being killed by my transfusion. We corrected it and instantly. We began procedures. The fellow helped me out, and we rescued the baby. And eventually, the baby left the hospital. Although it was a very dicey few days. And I remember that night. Crying, going to my room, and just sweating and shaking from this error.
Dr. Don Berwick is the founder of the Institute of Healthcare Improvement, IHI. Everyone can make mistakes. All caregivers should advocate for their patients when they are concerned that something could be wrong. There are some key elements that we can learn from Don's story. Don had performed this procedure many times before, but now he was in a new healthcare setting with different processes. He started the blood transfusion as he had done many times, but it had not contained the whole blood the patient needed. Why did this error occur? Based on the interview, it sounds like the hospital did not have a strong process to ensure the correct blood is administered and lacked adequate training. Don's actions did cause harm to the patient, but it was not due to reckless behavior. When errors occur, the organization must take action to reduce the probability that errors occur again. Our organization subscribes to a just culture, which realizes that mistakes happen, but reckless behavior is not tolerated. It is so important that when the errors occur, the organization take action to identify the root cause. The organization focuses on the process that contributed or allows the error. Therefore, the focus is not on the caregiver that caused the error unless it was due to reckless behavior. This approach builds trust among the healthcare team and encourages error reporting. Let's watch Fran Griffin describe what a just culture is in a little more detail.
So a just culture means that we don't blame individuals for system problems. For many years, healthcare did this, and it does unfortunately still happen sometimes. So if we think about a medication error, for example, and there's multiple steps that have to occur for a medication to get to a patient, any one of them can go wrong. And if the wrong dose has been prescribed and dispensed and is brought to the bedside and administered, well, clearly there's been multiple people involved in the error, and systems are not catching the error along the way. It doesn't solve the patient safety problem if we fire the nurse who was the last person in that chain of events and administered the medication, not realizing that it was an error. That doesn't prevent that error from occurring again. But that's what we used to do. We would fire the last person in the chain most often. And that did nothing to solve patient safety problems. And certainly if there were steps that broke down, those steps weren't getting fixed by firing the nurse. So in a just culture, we don't do that. In a just culture, we look at the event to try and understand what happened. If a person did something knowingly, knew it was the wrong dose, gave it anyway, then you're getting into what we call a culpable act. Or if the person was impaired in some way, came to work under the influence of alcohol or some other substance, that's a culpable act. Those people should be punished for those actions. And so in a just culture, what we mean is that it's not the case that nobody ever gets punished, which is when we first started talking in patient safety, we talked about non-punitive cultures. That made managers uncomfortable because they thought, and if it means a non-punitive culture, that means I can't discipline people who break the rules. And that's not what we meant at all. And so we moved to just culture to emphasize that if somebody breaks a rule knowingly and willingly, then yes, they should be disciplined even removed from the organization. But we won't blame people for systems problems. And so that's really the emphasis of a just culture.
One of our first priorities when a significant event happens is the well-being of the caregivers involved. As leaders, we must help support them and offer services such as EAP. Leaders must model this approach, and the caregiver must expect it. You have an impact on preventing errors and safety regardless of your role within the organization. A housekeeper forgets to put down a wet floor sign after mopping, and the visitor falls and breaks his hip. A registrar doesn't remember to verify 2 patient identifiers and registers the wrong patient to be admitted. The correct patient is allergic to penicillin. The incorrect patient is admitted for an infection and is administered penicillin. The patient suffers an acute allergic reaction. A transporter fails to check the patient's armband when preparing to transport the patient to imaging for a study. The radiology tech also fails to check the armband and performs a CT with contrast on a patient who's suffering from renal failure. This patient expires as a result of an incorrect study. The food services rep misses an MPO notice on a patient's door and delivers a tray to the patient, who consumes the food. The patient was supposed to go for an urgent surgery in the morning, but is now delayed. Plant Services does not repaint the curbs outside the hospital for visibility, and a patient falls on their way into the hospital for an outpatient surgery. The surgery is delayed, and the patient is admitted to the hospital for treatment to injuries sustained from the fall. A nurse aide fails to report critical vital signs to a nurse, and the patient deteriorates and has to be transferred to the ICU. A surgical tech doing a sponge count cannot find one, but makes the assumption that all are accounted for. The patient is sent home and returns 3 weeks later with a severe infection. The patient's taken back to surgery where they find the missing sponge. A nurse received a critical lab result from the lab without reading back the results. The wrong critical value was reported to the physician. The physician ordered a medication based on the wrong critical lab. Scenarios like these happen each day in hospitals, and they are all preventable. It's our job to implement actions and processes that will decrease the risk of errors occurring, which leads us to zero harm. We want you to be successful, so we have developed training to give you the tools you need to prevent errors, report events, and prevent workplace violence. The following training modules will be assigned to you in our online learning platform. Don't Harm Me, Heal Me, Be Nice to Me, New Employee Training, MissionZERO Error Prevention Training Module 1, MissionZERO Error Prevention Training Module 2, Tridio Training for Caregivers, and Workplace Violence. Within the first 30 days of employment, please complete the training so you have the tools you need to prevent harm to our patients and other caregivers. We ask all caregivers to commit to safety. Therefore, we ask you to follow these safety commitments as you begin your role within our organization. I commit to personal, patient, and team safety by practicing team member checks and team member coaching using ARC. I commit to clear and complete respectful communication by practicing the use of SBAR to communicate issues or concerns requiring action, or using repeat backs and readbacks with 1 or 2 clarifying questions. I commit to having a questioning attitude by practicing stop and resolve when questions arise. I commit to paying attention to detail by practicing self-checks using STAR. I commit to having a questioning attitude by practicing stop the line when I'm uncertain or have concerns. You will receive full training and education on the online training platform regarding safety commitments and error prevention techniques. Did you know that error prevention techniques reduce your chance of causing an error by 10 times? We use the following techniques within the Ardent Health System: ARC, repeat backs and readbacks, standardized handoff, stop and resolve, SBAR, STAR, and stop the line. Kina was a college student who went to work a summer job in Alaska. Within the first 40 minutes of her first day on the job, she was cleaning a conveyor belt that somehow got turned on, causing her arm to get stuck. Nobody in the plant knew how to turn the conveyor belt off. Kina's arm was broken before it eventually got ripped off. She now goes around sharing her story and discussing the importance of workplace safety, so I will leave you with this quote: "You are the last line of defense in safety. It boils down to you. Thank you and welcome to our team.